Welcome back to Tales from the Table. Today, I'm actually going to talk to you about one of my failures, which a lot of people don't really talk about, especially when it comes to healing people. And it's not so much that this was a failure per se, but this was very early on in my career. And for the first time in my life, I actually couldn't help somebody immediately. So, what was this? There was a young girl who came in. She was working down in Miami at a big box store. I can't remember the name, Nordstrom, something like that. And she was a very petite girl. I want to say she was maybe 5'2", 5'3", something like that, and weighed probably 105, 110 pounds. And she had come in complaining about back pain. And when I was questioning her as to how and why the pain developed and how long she had it, et cetera, she ended up disclosing to me that she was responsible a couple of months ago for lifting some really heavy boxes that were in the back and bringing them to the front. Now, in all reality, they probably weren't very heavy, but to her, they were. And she said, ever since that day, my back pain progressively got worse and worse. So I thought that was kind of interesting. And I ran her through my normal protocol. Glutes were okay. There was a little bit of like hard soft tissue. That's obviously doesn't make any sense. The soft tissue, there was an adhesion somewhere on the right hand side of her back, close to her spine, over her rib area. And as I would work on this adhesion, it would start to dissolve. She would feel better for 2 to 3 days. And then she would be calling me to make another appointment because the back pain was coming back. And even though this was around 2014 and 15, where I didn't really know what I know now, I still knew that it was not right, that the work I was doing was not lasting as long as it should. And at that point, I was keeping people pain free after 1, 2 sessions for close to 3 to 6 months. And I'll get to that a little bit later too. But this girl was coming in 2, 3 days later and, I need another session. She would be good. And I'm like, this just doesn't make sense. Doesn't make sense. Go to the doctor. I need to get you. I need you to get an X-ray, MRI, something like. Go and get yourself checked out. We need an image. Something's going on internally that I can't see. So she ends up calling me after she got that MRI and the X-rays. Told me that, to her surprise, she had 3 herniated discs and a fractured vertebrae. So this is where the protection was coming from. I don't know if those herniated discs were coming, they were already present. And then she went to go lift those heavy boxes and the body just said, I can't deal with this. And as the pull got greater and greater on the spine, we ended up getting a fracture. But that was the reason for the protection. So the body was protecting the 3 herniated discs and the fracture. I would come in there and kind of wave my magic wand and be like, calm down, fascia and muscle tissue. And it would calm down because of the touch. And then, as she would go about her life and move around, it would come back. And that is something that I cannot fix. Okay. The fracture needs to heal, which is what we did. So I recommended you let the doctors take it from here. Listen to what they're saying. I also gave her a couple things that I wanted her to do. I had her buy a TENS unit to use some Russian stim. Okay. Whenever you're ordering one of those, never just get a TENS unit. Make sure that it has Russian stem. Russian stem is the only frequency that has been known to help strengthen the fascia and the accompanying muscle tissue that you are sending the electrodes into. Okay, they have them on Amazon. I think my favorite one is like $179. Works every time. All right. It's fantastic. So after that 3 months of her doing reduced work at work and not really lifting anything heavy, letting that fracture heal, she ended up coming back to me. And the adhesion was still there, but this time when I started to work on it, it went away and it would stay away. She was getting progressively better and better every single session that she had until she was 100% pain free. And she never went back for another image to see what was going on with the discs. About 20% of my clients will go back and get another image just so they have that peace of mind knowing that the body has healed itself. But then 80% of people are like, well, I feel fine. There's not even an inkling of pain. So I'm not going to go and pay for another x-ray or MRI. And they don't want to subject themselves to the magnetism or to the radiation. So it makes sense. But I say that to say this. On my Instagram channel, if you're not following me, go check it out. It's the same name, at the Pain Bibles. I put up a post talking about 3 horror stories that came across my desk the past week, 10 days or so. And I'm going to start off with the first one, a lady talking about a 41-year-old gentleman that she knows. I don't know if it was her brother, her friend, or her husband, but he was having back pain. He went in to the doctors and they said, you got a bulging disc. We're going to have to operate on that. And when they got in there, they realized that it was worse than they thought. So they ended up taking it out and fusing vertebrae. Well, what ends up happening? He wakes up and his left leg is paralyzed. Okay. And it's just like, could you fathom anything more horrendous than that? Going in for what they typically call a routine surgery or procedure, and then you come out and a body part isn't working. So she ended up hitting me up on Instagram and she's like, hey, we really love your stuff. I was wondering where we go in terms of putting our time and money from here. So I ended up replying to her. It was about a 5-minute reply, 4 minutes and 53 seconds of a reply. And I went through the whole gamut, the whole kit and caboodle. I threw the kitchen sink at her and said, when we are looking at herniated discs, we are looking at what is called global compression. So the entire system, like a corkscrew or like a crank, is spinning and tightening fascia up into one specific area. And like a spider web, as everything draws into the center of that black hole, we get more and more compression. And what's going to end up happening? We sandwich that disc and the peanut butter and jelly comes out, or just the jelly. There's the jelly, the water comes out of the disc, the disc wall will erupt, and then all of a sudden we either we don't have it erupt, we have a bulge, or we have a complete herniation, okay, where that thing's just blasted open, right? And now I make a very strong case in my book, The Back Pain Bible, about how we can release the tissue surrounding the disc. And what happens is as that tissue starts to release and we get expansion of that myofascial cavity, what ends up happening is as the disc starts to pump itself back up again, it will rehydrate, heal, and what ends up happening? You don't have a herniation anymore. Okay, and there are many people. Andrew Locke is a great resource. He is a myofascial therapist in Australia, and he's confirmed this on MRIs. He showed, like, look, this is what my client came in with: 3-4 disc degenerations. They're dehydrated or they're herniated or something like that. And then he shows the same person a couple months later, and the discs are built up and puffy and rehydrated again, right? And what people don't understand, and we could go down an entire rabbit hole about this, but what people don't understand is all the fascia bros out there want to be talking about how fascia connects everything. It's a connector. It's a connector. It's a connector. Yes, it is a connector, but there are many different levels to the game that it plays. Okay, it's working against gravity. It's working with your breath. Gravity is the master and commander of the force load capabilities, and then your breath is the master and commander of its movement. If you need to breathe, fascia says yes. That's the only response it gets. Fascia is a yes man in that respect. And then if we put a 250-pound bar on our back, in accordance with gravity as well, fascia says, I will do my best to support this. Okay. And then it tightens up specific aspects in the body in order to provide you support to move. All right. But all the fascia bros and a lot of the doctors and maybe some of the chiropractors and then the physical therapists that understand fascia, they only understand it as a connector of things. What fascia also does is it's a separator of things. So when fascia restricts and contracts and we start to squeeze the jelly out of that sandwich, and then we release fascia as it expands, so do the structures. Why? because everything is a secondary support structure to fascia. The muscle is, the nerve is, the discs are, your cartilage is, your meniscus is, your labrums are. I could go on and on and on and on. Every single other structure, even your bones, are a secondary support structure to fascia. They help fascia do its job. And the way that bones do that is through being an anchor point. The way that muscle does it is by growing and providing a greater cross-sectional area for fascia to contract on. The way that nerves do that is by saying, yes, and affirming fascia, I do feel, I do sense something over here. We know that fascia has 10 times, 100 times more nerve endings in it than the actual central nervous system moving throughout the body. We need to look at all these things. Oh, I wore out my cartilage in my knee. Well, why did that happen? I can guarantee you that quad and that hamstring are so incredibly tight. And where did they attach? Where do these tendinous attachments go to? They go down to that tib fib area, the fibula and the tibia. Okay. And then what ends up happening? That calf comes up with its tendons and attach on the femur. Okay, so what ends up happening with that? The quad and the hamstring get so tight along with the calf that it squeezes that joint structure together. The bone gets closer and closer. And as you move, now instead of cartilage and meniscus just being a supportive structure, now it's literally being suffocated and hanging on for dear life because we're grinding now. We are too close together. And that takes a really long time to correct. A really long time. Could you imagine having to open up this massive tube that is your leg, the quad, the adductor, the hamstring, opening up the TFL, the IT band? It can't really open up, but you need to release the vastus lateralis, which is underneath it. Okay, and then you have the gastroc and the soleus, the peroneals, the tibialis anterior. I mean, everything is just getting short and tight, contracting, and it's squeezing those three bones closer and closer together till even simple walking or getting out of bed in the morning is going to create friction on a pad that is supposed to be gliding. Okay, now we have a coefficient of friction between there instead of it just being a gliding supported structure. So this is how we need to think about the spine as well. All right. And I went on and on with this lady for 4 minutes and 53 seconds, talking about how sleep is going to be a factor, stress is going to be a factor. Is there a positive correlation or a negative correlation? What type of food are we eating? What type of water are we drinking? Is the water full of electrons and hydrating the cytoplasm, or is it full of protons and bulk water and just dehydrating you continuously? And by being 41, I can 100% guarantee that it was. I can guarantee that this gentleman is drinking bottled water, tap water, just garbage bulk water that has no electrons, no life force in it at all. It's not hydrating the fascia. It's not creating a perfect battery where it's negative on the inside with cytoplasm and positive on the outside with calcium and potassium, etc. It's okay. What is happening is just complete disarray. I went on to ask, what are his movement patterns like? How long has he had his bed for? The type of mattress, the footwear. I went on and on for 4.5 minutes. Do you think I got a response? Absolutely not. This lady didn't even reply. I don't know if it was because it was information overload or she was just like, this guy sounds like he's full of shit, or it's because it sounds like what they've done in the past is just the easy solution. Just knock me out, give me surgery, and then I'm going to wake up and be okay, right? The bare minimum of effort on my part. But now look what happens. So while I consider that first case a little bit of a failure, overall, I was able to still help her. There are plenty of other examples I could give you where I've worked on people who have had a herniated disc confirmed on a MRI. I've worked on people, the most that I ever had is up to 6. Okay. And it was 2 cervical, 2 thoracic, and then 2 lumbar. It was a girl who got in a really nasty car accident. But I'm telling you all of this because so often people who have herniated discs are given these death sentences of it only will get better if you have surgery, or you're just going to have to live with this. The body is not designed that way. When you expand the components and create space again, you will not have any pain. And people don't understand that. Well, where's my cartilage? What about my hip? I saw that it was bone on bone. Well, when we create space and it's not bone on bone anymore, remember, fascia has two jobs, not to just keep things connected, but to keep things separate as well. So it's the secondary support structure that's gone, but the body is so beautifully and intelligently designed that it still has its primary support structure. Okay. You take a piece of rebar out of the foundation of your house. Does that mean the whole house crumbles? No, the house is still there because there's other pieces of rebar, but more importantly, because the cement was cured over time and it's hard as hell, right? So we got to move out of fear. Move out of fear with this stuff. If you look at Jean-Claude Gimberteau or the gentleman who does the Eldoa stretches, which is a fantastic resource, Guy Voyer, he has since left us, but absolutely phenomenal resource. And the guy loved what he did and he knew what he was talking about. And he was onto a lot of things that we just don't hear in mainstream media or medicine today. But he showed a lot of examples of both of these guys are French, but he showed that in France, they operate on between, I think, 10 or 18% of herniated disc cases. The rest of them are rehabbed. Okay. In the United States, we operate, I think, somewhere between 72 and 78% of herniated disc cases. Arrest my case. Ladies and gentlemen, hear ye. Bring order to the court. Arrest my case. You cannot convince me otherwise. And what I'm going to do this coming week is I'm going to get my longest standing client to do an interview for me, with me, all right? And we are going to go through everything this gentleman had to endure in his life as a result of him herniating 3 discs and how he is happy and healthy today, even though he's older and technically, supposedly supposed to be getting worse, all right? So I know today was a bit of a rant, but I'm very passionate about this stuff because I believe the body is designed to be able to heal itself. You just need to give it the tools to do so. And that's where I'm leaving you off here.